All right, I got it. Awesome. Thank you guys for all coming this morning or this afternoon on the East Coast, and welcome back, Dr. Jennie Walker. So exciting. We haven't had the it's been a lifetime ago. When was almost 3 months ago that you were with us?
I don't know. I was looking. I couldn't find it on my calendar. When did we do the last one?
It was pretty close to when we all started shelter in place. So I think it was close to 3 months ago.
Yeah.
It had to be, yeah. So anyways, we're back, and thank you for taking me up on me asking you to come back, because people have been asking, and so we're going to talk, or not we, Dr. Jennie's going to talk more from the holistic side of things today, and then we'll do some Q&A at the end. So I'm going to put myself on mute, and we'll keep this interactive. If you guys have questions, you can chat or unmute yourselves, and get ready to just bring in some good knowledge. So thank you again for being here.
Yeah, thanks for having me. So I thought, well, first of all, for anyone that wasn't here the last time, my name is Jennie Walker. My primary job was is as an emergency physician. I've been an emergency physician in Mammoth and various other hospitals for about 17 years now. And a few years ago, I started to learn more about the functional side of medicine, and have done some functional medicine training. I've completed the certification with the Kresser Institute, and I'm mostly done with the certification process with the Institute for Functional Medicine, and now I have a small private practice here. And I have a partner too now, Kim Escudero, who was, some of you may know, she was one of the pediatricians at the hospital. So the last time that we did this conversation, I had mostly notes about what coronavirus was. I think we've now heard that 5 bazillion times, and just kind of some basics. And I've added on to my notes, and then I've forwarded them to Rochelle, which she can post if you'd like to see them afterwards. But it includes my notes from the first time when we talked about, what it was and how to prevent it. And so today I thought I might go over what has changed in the last 3 months, and also more of a functional medicine perspective of what things you can do to help prevent infection or treat it if you get it. As you all know, we've done a really good job of slowing the spread of it. So hopefully you're all healthy, but it's still out there and it's not expected to go away anytime soon. And there's no, they're working on vaccines, but vaccines are tricky for viruses. And so unfortunately we have to just stay vigilant for a while. Some of the things that, let's see here, some of the things that are concerning about it that hasn't really changed is that the incubation period can be up to 14 days. And you can shed virus during that entire time. And so that is part of why it's been so infectious. And so one of the things that we have to do is try and prevent spread of the droplets, even in people that have no symptoms. And so now you're all seeing that there's, mask orders or facial covering orders. A mask is technically a surgical mask or an N95, but a facial covering is any type of cloth mask, and that can significantly decrease the amount of respiratory droplets that are spread. The other thing is distance. And so if you're not wearing a mask, you should be at least 6 feet from somebody. And it has a lot to do with the amount of time of exposure too. So if you're walking outside and someone goes walking past you and they're only within, closer than 6 feet for a few minutes or even a few seconds, that is not very high risk. But if you're standing close to somebody and they're talking very loudly, or they're coughing or they're sneezing, then obviously your risk of acquiring the infection goes up. And when I was doing some research for this, I thought it was interesting that there's some evidence that the amount of viral burden that you get exposed to significantly affects the way you respond to the infection. And so there's been a lot of concern about all these healthy healthcare workers who have gotten really severe disease, and some have even died. And that may have to do with the amount of virus that they're exposed to, that they just keep getting, repeated exposures. And so that affects how their immune system responds. Um, let's see here. I did in the notes, I put a link to a really interesting article that was in the New Yorker a week or two ago that talks about, it's from the perspective of someone who works at one of the big hospitals in Boston, or the big hospital systems, and talks about all the things that they've done and how they've really decreased the amount of spread within their hospital system, and that it has a lot of good recommendations for what we need to do going forward as we start to open up the community. Let's see here. So we all know that, typically it's cough and respiratory symptoms, but you can have GI symptoms, you can have skin symptoms, you can have a loss of smell, which we didn't know 3 months ago. That's kind of a key one. Typically people that get really bad with the respiratory symptoms start to have problems around day 7 or 8. And then unfortunately, symptoms can last for weeks and weeks and weeks. And so now if you are having symptoms, they recommend that you self-quarantine until you are asymptomatic for 3 days. And that could be a really long time for some people. We have been finding that when you do the nasal swab for people, that nasal swab can stay positive for 3, 4, 5 weeks, although we don't know if they're very infectious. It may just be dead virus RNA sitting up there, but people are testing positive for really long time periods. And that's one of the things that's changed quite a bit since we last talked. Was originally you could only get the PCR nasal swabs at outside labs. So in remote locations like here, it was a send out test and we wouldn't get the results back for sometimes up to a week. But now most hospitals, including the one that I work at, has about an hour turnaround time for the nasal swab. So there's a lot more testing that can be done. There's still some controversy over whether or not you want to test a lot of asymptomatic people. That's really more for epidemiology, trying to figure out the incidence of disease in your community. There is also antibody testing available. And unfortunately, that is not the panacea that we were all hoping it to be, because the sensitivity and the specificity, meaning false negative and false positive rates, is not very good. And there's a lot of different tests out there and they haven't been particularly well vetted. You can get them without a physician order at private labs like LabCorp and Quest. If you come back negative, there's a good chance that it's a false negative and you may have had the disease. If you come back positive, there's a good chance that it's a false positive and you may not have had the disease, and you may go out and think that you're potentially immune. So it's unfortunately, it's not a great test yet. So one of the things that we're starting to understand that we didn't really understand before is that COVID is so much more deadly than some of the other viruses that we see, because it actually is able to stimulate the immune system and kind of send it into overdrive, and it causes a release of these, what we call pro-inflammatory cytokines. And they call this a cytokine storm. And it's like your immune system goes into overdrive and creates a lot of debris that stimulates inflammation and oxidation, reactive oxidative species. And so that's a lot different than some of the other illnesses that we've seen. And so we're having to try and figure out ways to calm down the immune system, actually. I know the last time we talked, one patient asked, does autoimmune disease increase your risk? And at first I didn't think, that there was much of a correlation, but now it does look like if your immune system is already in overdrive, you are at risk for having much more significant complications from this virus. So there still hasn't been much advancement in medical treatments. There's still, other than, I think you've probably all heard that hydroxychloroquine has kind of been ruled out, even though the president took it. It doesn't really show much effectiveness against the virus in the studies that they've done, and it has pretty significant cardiac toxicities, particularly when combined with other medications. And then there is some promise with remdesivir, which is a medication that was developed for Ebola, but there really isn't any magic bullet yet. And so really, now you just kind of look at the functional medicine approach. What can you do to help yourself stay healthy and prevent getting the illness? And if you do get the illness, what can you do to help prevent you kind of rolling over into this cytokine storm where your immune system goes haywire? So I've kind of broken it down into prevention and treatment options, and we talked about these too. Sleep is extremely important. Good quality sleep promotes what are called T helper type 1 cells, which secrete this chemical called interferon gamma, which has good antiviral properties. And then stress management is really important because elevated cortisol levels are known to are pro-inflammatory and can actually suppress the immune system. So the interesting thing about the immune system is you need it initially to help you combat the virus and hopefully have just a mild course. It's only a certain percentage of people that go into this overactive immune system. So one of the articles that I was looking at talked about a phased approach where initially you want to support the immune system, but in the small percentage of people where it becomes overactive, then you have to bring in the anti-inflammatory treatments to try and calm it down. So right now we're talking about actually stimulating your immune system to help you fight it. Exercise, as Rochelle knows, is excellent for immune systems, but it should be moderate exercise. Extreme exercise like prolonged long distance running or really high intensity exercise can actually increase interleukin-6 levels, which are inflammatory. But moderate exercise can really lower your inflammatory markers. Nutrition, always super important. You really want to eat a really colorful diet because all the colorful foods, all the colors of the rainbow have phytonutrients in them, which are anti-inflammatory, antioxidant, and full of all the good vitamins and minerals that your immune system needs. You want to avoid processed and packaged foods because those are all pro-inflammatory. They all have rancid fats in them. They all have refined processed flours and sugars, which are inflammatory and affect your blood sugar control. And you want to minimize alcohol, which is really kind of tough these days. You know, you don't want to go crazy with it. Maybe a glass in the evening to get over your homeschooling trauma. And then some supplements that you can just kind of take on an ongoing basis to help maintain a good immune system. Vitamin C is really important. Either you can get that from supplements or you can get that from colorful fruits and vegetables. Usually they recommend 1 to 3 grams a day, typically in divided doses. And it works best if you're taking it before you get sick. But they are doing some studies on, and they've been doing these studies for a really long time. This is not just for COVID, but some ICUs are using really high dose vitamin C as an antioxidant, anti-inflammatory. Vitamin D is super important. I think it's interesting, you know, they talk about whether or not this virus will be like other viruses like flu, where it tends to fall off in the summertime. It's not really showing that because, you know, now we've seen areas that are quite warm and quite tropical, like Brazil, that are still getting hit really hard. But vitamin D is really important to your immune system. So it may be that we're just better at fighting the initial infection in the summertime because we get more vitamin D and our immune system is working a little bit better. So vitamin D increases macrophage function, and macrophages, however you want to pronounce it, is these cells that go around and eat bad things, and then antimicrobial peptides. Kind of a good baseline dose for most people would be 1 to 5,000 units a day if you're not getting any testing. It's really one that's really easy to test with just a blood test. And so if you can follow it, that would work a little bit better. Some people need a lot more, and particularly living at high altitude, we have a tough time getting enough serum vitamin D. There is some concern that really high doses can worsen COVID infection. So really it's best to just get your levels up where they should be, which is usually between 40 to 60, some people say even up to 80, and then maintain those levels. But if you get sick, don't start taking whopping doses of it. You just want to get it to a healthy level. The other one that is really important is vitamin A. And actually, all of the fat-soluble vitamins are really important. My mom's listening to me right now. She's a nutritionist, a registered dietitian. She'll be very proud. There's 4 fat-soluble vitamins, A, D, E, and K, and they all work well together. And so especially A and D kind of work in balance. And so if your vitamin A levels are decreased, that can increase your risk of, I'm sorry, the other way around. If your vitamin D levels are low, that can increase your risk of vitamin A toxicity. So you kind of need them in balance. And one of the good places to get fat-soluble vitamins is fish oils, particularly cod liver oils. So you could just take that rather than a specific supplement. But vitamin A is really important for your immune system. When you have a deficiency, it impairs the antibody response, decreases levels of your helper T cells, and actually impairs the mucosal linings of your respiratory tract and your GI tract, which is where those are the barriers that help prevent infection from getting in the first place. 34% of adults in the US are they think are deficient in vitamin A, and up to half of us, 25 to 50% of us have genetic polymorphism that impairs your conversion of beta carotene to vitamin A. So beta carotene is found in all those bright orange and red vegetables, but up to half of humans can't convert that to retinol. So it's really important if you're going to take a vitamin A supplement that it not just all be beta carotene, that either it's a combination of beta carotene and a retinol or just a retinol supplement. And probably a safe range of supplementation would be 5 to 10,000 units a day. Some people say you can go even higher than that, but if you're eating a nice colorful diet and if you're eating some good healthy fats, then you can probably take the lower dose. Zinc is also important for your immune system. It inhibits viral replication. So the lozenges are good if you've been exposed because it can decrease viral replication in the throat. If you actually have an infection, it can also help decrease the symptoms. And the dosing on that would be 10 to 20 milligrams a day, usually divided throughout the day. Well, 10 to 20 milligrams 2 or 3 times a day. So up to 60 milligrams a day. But if you're going that high with zinc, you typically need to add in a little bit of copper, low dose of copper, because overdosing on zinc can deplete your copper levels. Elderberry's been around for a really long time. It's really good at fighting viral infections. Typically, it's about 500 milligrams a day. And you need to be careful of patients with autoimmune disease because it can overstimulate the immune system a little bit. You want to keep your gut really healthy. Again, I mentioned it before, your gut is your barrier. That is what helps keep everything out. And also a huge percentage of your immune system is in the cells in the lining of the gut. And so probiotics, a good quality probiotic or bone broth on a regular basis can help kind of maintain your gut health. And then there's a couple antiviral things that I mentioned the last time. They're in my notes if you want to look at them later, but olive leaf extract, and there's some combined herbal antimicrobials. But what I wanted to talk about more today was what happens when you do get sick, because we didn't really talk about this very much last time. So there's several different tactics that you can take to work on this infection. One is inhibition of interleukin-1 beta production. That's one of the really pro-inflammatory cytokines. And there's several supplements that can help with that. And a lot of them you've probably heard of, some of them you haven't. One is resveratrol. That's a polyphenol that's found most commonly in grape skins and red wine. That one they usually recommend 100 to 150 milligrams a day. Curcumin is the active ingredient in turmeric. So you can cook with a lot of turmeric, do a lot of curries, or you can also supplement with the curcumin, the actual ingredient. The Longvita form is much better absorbed than straight turmeric. and it's the dose on that is 500 to 1,000 milligrams a day. Green tea is really good. It's a really good antioxidant and anti-inflammatory. The main component of green tea is called EGCG. I'm not sure I'm going to pronounce this right. Epigallocatechin gallate. And you can either have like 4 cups of green tea a day, which is kind of a lot. I'm not very good at drinking that much green tea, or you can supplement with 225 milligrams of the EGCG. Quercetin is a really good viral inhibitor, and it is it's called it's a part of a group of chemicals called flavonoids that are found in foods. Quercetin is in particular found in the skins of apples. The recommended dose of that would be 1 gram twice a day. That one's really good for asthma and allergies, so it is sort of allergy season. I frequently recommend that instead of using like over-the-counter allergy medications. And the last one is melatonin. Melatonin is really good during an acute infection. You can actually go up to doses of 20 milligrams a day, but I typically wouldn't recommend it on an ongoing basis. There is some theories that it can suppress your own internal melatonin production if you take it long term. So another area of fighting this virus is cellular defense and repair. The main one that you would use for that is an antioxidant called N-acetylcysteine. There's actually a variety of different forms that you can use. It helps you regenerate your glutathione. So you can actually just take liposomal glutathione. It helps support liver function, detoxification, and it's a really good antioxidant. So the dose of the abbreviation is called NAC. The dose of NAC is 600 to 900 milligrams a day. And then the last thing is medicinal mushrooms. I can't get my family to eat mushrooms, so, but I love them. You could just eat a wide variety of mushrooms. Shiitake, lion's mane, maitake, reishi, those are the ones that are traditionally used in naturopathic medicine. They are known to increase B cells and other innate immune cells and improve your gut immunity. One recommendation I saw was for a reishi supplement, which is 400 milligrams 2 to 3 times a day. I actually put a little lion's mane in my coffee in the morning. It helps stimulate brain function. So those are just kind of some kind of foundational immune stimulant, anti-inflammatory supplements. And so that was kind of all I had for today, kind of as an update. There's a few questions. Rochelle actually asked me how much copper. The copper dose is really low. It's like 1 milligram, 1 to 2 milligrams. The one in apple skins for allergies, that's quercetin. Quercetin you can take 500 to 1,000 milligrams like 3 to 4 times a day if you're having really bad seasonal allergies. And then that's it for the questions in the chat box. There was a question about colloidal silver. I actually don't know that much about colloidal silver. Sorry. That's not one that I've seen really in the functional medicine literature. I have heard of it in the past for antiviral properties, but I don't know anything about it. Yeah, zinc and copper are found in a lot of foods. I would have to look up where copper is found. But I think if I remember correctly, shellfish, let's see here. I actually have a thing that talks about food sources of zinc and copper. Sorry, it's taking me a while to find it. So my mom is asking that high HDL is protective. She says shellfish for zinc. Good. That high HDL is protective. I have not heard of that, but high HDL is definitely good, though. But I don't know specifically.
if anyone has like a question they want to talk or like not just chat, no, that was super informative, and I wrote down a bunch of stuff I didn't know about the copper. That was new because I've been doing more zinc for sure in our repertoire. But yeah, just the homeschooling thing, I was laughing. That's been the hardest part about all of this. And the impending, I mean, no one knows, even what we knew 3 months ago has changed so much, but like, it's baffling to me that they're already talking about like not going back to school in the fall. I think my anxiety levels are going to need to be rung in over that one. But yeah, no, I was just going to see your thoughts on that.
Oh, yeah. I just listened to our local school community, whatever, meeting last night. And they're talking about if we do go back to school, a maximum of 10 kids in the classroom at one time. And so for some reason, that means that you could only go to school like half a day, twice a week. So I have a little bit of mixed feelings about this. The first time we talked about this, we talked about flattening the curve and how important it was to flatten the curve. And it was really important to flatten the curve, but it seems like everyone has forgotten that the point of flattening the curve was to make sure that the hospitals could take care of people that got sick, so that we had all the resources to take care of the people the best that we could. Unless there is a vaccine or a specific treatment, which is not likely going to happen anytime soon, we kind of have to let the virus spread a little bit, and it can be a little scary for people, so if you have autoimmune conditions, or if you have underlying health conditions like diabetes, high blood pressure, or you're older, then you have to protect yourself and take responsibility for wearing your mask and staying away from other people. But we do kind of need the virus to spread a little bit amongst healthy people so that we can get some herd immunity and get our economy going a little bit more. And so I think you're definitely going to start to see that now that they've reopened businesses and restaurants, and so it's going to spread and our numbers are going to go up, but hopefully we're getting better at treating people. One of the other things that I forgot to mention is that because this is such a big respiratory illness, initially they were admitting all these people to the hospital, but now it really is better if you move. This goes really well with VFit, but you want to move, you want to use your lungs, you want to keep expanding your lungs. When you sit in a bed with oxygen on all day long, parts of your lungs they call it dependent, and they don't inflate as well. And those are the patients that seem to be getting worse. And so, when they get really critical, they start to prone them, they flip them over so that you're using the back of your lungs, and then they flip them over again. So you're using the front of your lungs to keep those, to keep your lung function working throughout your entire lung volume working. Kathy, did I see you raise your hand? No. Anything in particular to help with depression? That's a tough one. Oh, sorry. We can go. Kathy, what were you going to ask?
I was trying to get my unmute button. I'm sorry. I'm just wondering, I'm glad you addressed that was me that asked about autoimmune conditions and increased risk. And so I'm trying to figure out how I navigate my life in particular as we go through the reopening. If you have specific recommendations on that, I'm thinking that I should kind of stay home as much as I possibly can, but I don't want to overreact either. So do you have specific recommendations for somebody who deals with autoimmune issues? And I know my immune system will go into overdrive.
Right. Yeah. I mean, unfortunately, I think that as this virus starts to spread, that you are probably in the category of people that needs to take more precautions than most people do. And so, if you are going to go out and have dinner or eat out somewhere, it should probably be sitting outside. You probably shouldn't be sitting inside a restaurant. If you go into a store, you should make sure that you hand sanitize and don't touch your face, and keep your mask on, and, you know, and try and stay away from other people in the store, and really minimize going out, because, you know, you are at a higher risk of having, developing that, you know, overdrive of your immune system.
Yeah, I appreciate that. I've been going back and forth in my mind, you know, I have a dentist appointment coming up, and that's pretty high, I guess, I'm not sure the right word, but seems like if there's going to be a transmission, a dentist office has a lot of risk involved. And,
yeah, it depends on, I mean, you could talk to your dentist. I have not actually heard much about dentists. I have an appointment coming up too. I really am looking forward to it. But because they do a lot of aerosolizing procedures, you know, they're grinding and spraying, and there's probably a lot more of the virus potential for being in the air. And so, you know, you could request to be the first patient of the day. You could request to be put into a room that had been, you know, completely disinfected. I assume they're doing that anyway. But, you know, at least that had a few hours for the surfaces to be wiped down. That's a tough one. Yeah. You might just want to brush your teeth really well and put it off unless you absolutely have to go.
Involved treatments. I kind of decided to put it off, and you hearing what you had to say about it made that more firm in my mind. So I appreciate that. Thanks.
Oh, good. Okay, so my mom just said she just went to the dentist and they were super cautious. They did not polish her teeth because of the aerosol.
What state does your mom live in?
Southern California.
Oh, she does.
It's its own state.
Okay, and we will get to your question. Linda, we will get to your question because I think that's an important topic to bring up, the mental health side of this. But Frances has a question real quick.
Well,
yes, I saw that.
Actually, I think, Jenny, you answered my question, because Kathy, I have an autoimmune disease also. And my question is, I don't know whether to wear a mask or not, because some say, yes, mask helps, and others say, no, you're actually breathing your own air and it's not healthy. So I never know when. I don't go out much. Because of my autoimmune disease, I mainly stay home in the fresh air. And in our county, we live in a small town in Oregon. We haven't had one death, and it had 2 people hospitalized. But now that the tourists are going to be coming in, I'm thinking it's going to be a lot more significant.
Yeah, I don't see what the downside would be of wearing a mask. I mean, the goal of a mask is twofold, actually. It's one, to make sure that you're not infecting other people if you're an asymptomatic carrier. And it's also to make sure that you're not breathing in droplets of other people that are around you. So rebreathing your own air, it's not good for long periods of time, but the masks that we're using, or the facial coverings that we're using, are mostly cotton. And so your carbon dioxide can get exhaled through that. So it's not like you're probably rebreathing a little bit more carbon dioxide. You know, they're not fun to wear for long periods of time, but I don't think that they're dangerous.
Thank you.
And then there was this question about depression. That's a really tough one. There's a whole lot of stressors now that we've never had before. There's a lot of isolation. You know, fortunately, we're rolling into some better weather. And so really, it's all of the things about self-care that are important to keep in mind. Getting outside, getting fresh air, getting vitamin D, getting, trying to do, when this all started up, I was better at trying to do a gratitude journal, just to really keep in perspective, you know, all the good things. I don't have any specific recommendations. You know, if it is an ongoing problem from a functional medicine perspective, sometimes it can be related to nutritional deficits and methylation defects. And so, you know, a good workup from a functional medicine practitioner can sometimes help balance those out a little bit.
The reason I was asking is I don't suffer from depression, but my husband is chronic. So he's on medication. And I've noticed it's just he and I in the home, and we're pretty isolated, very isolated from our family. So he does get a lot of vitamin D. He walks out every day, but I just notice he's just really, you know, a lot more depressed and down and unmotivated. And so I just didn't know if there was anything supplemental wise that I could add to him to help him during this time.
Well, it's a little tricky depending on what medications he's on. You know, the ones that are most commonly recommended are things like St. John's wort, but that can have a lot of interactions with antidepressant medications. So it's hard to just, you know, think of one particular one. You know, if he can get out and do some activities that he was doing before in a socially distant way, then, you know, maybe trying to get some more personal communication or interactions with people. You know, we've started having people over in our backyard so we can all sit outside and talk and see, you know, and really reconnect with people, because that's been really hard for this.
Yeah. It definitely has. And I just think it's just the situational, you know, part of it. And when he is a very social person. So when he does have those opportunities, it does lift him up and pump him up. I just didn't know if there was anything, you know, any specific vitamin or, you know, something I could add. But if there's not, you know, I just thought I would ask.
Yeah. Sorry, I don't have anything.
That's okay. Thank you.
No, I think that's a good question, because even, I mean, for a lot of us just having to juggle everything right now or be isolated, there's just, the mental health side of this is going to be a big side of it to come, I guess.
Yeah. Well, and I think a huge part of it is that we don't know when this is going to end. Yeah. You know, and so, you know, if there's not an obvious light at the end of the tunnel where you can be like, okay, hunker down, I'm going to make it through this. This social distancing or physical distancing and all these crazy new restrictions are going to be around for a while. And that alone is depressing, even if you don't have baseline issues.
Any other? This has been great. I have it recorded too, so you guys can go back, and I have the notes, so we'll make a nice, Alexis has a question. When you were talking about all the phytonutrients, Alexis was packaging her farm box. Tell us, I saw asparagus and artichokes. What else was in there, Miss Alexis?
You have to unmute.
Oops.
Oh, thanks, Jenny. Raspberry apricots, which Jordy ate 3 already.
Oh, so and you're getting your vitamin D.
Yeah. Oh, yeah. We're working on it here. Jenny, so my question to you is, and this is something, you know, especially with having kids and just being in the healthier range of people, you know, we're because of our isolation, we're not being exposed to other illnesses and other things when, like with our kids, what are the concerns for the future and them getting sick and us getting sick and then not having immunities to, you know, things that we should be exposed to?
Well, you know, I think, first of all, hopefully your kids are playing in the dirt.
I'll show you here. There he is.
Yes, excellent. Yeah, you know, you're right. We're seeing in the emergency room, you know, we're not seeing hardly any patients at all. You know, I mean, like in the summertime, you usually see a bump in strep throat. And then, you know, we're just not, we're hardly seeing anything at all. And you're right, that's part of why my personal feeling is that we kind of need to get back to some sort of normality, and some people need to just, you know, unfortunately suffer through the virus. And they're saying like 80% of people have very minimal or no symptoms at all. So it's just scary because you just don't know who's going to be that person that really does poorly. I don't know what it's going to do for our baseline immune status. I have been a big believer in germ exposure for all of my kids' lives.
Yeah, me too.
So it'll probably
Lick
just
that.
delay it for the little kids. You know, the little kids all went, you know, you go to preschool so that you can get all those bugs, and then you can go to elementary school and not get sick. So you might just see a lot more kids getting these illnesses later on because they're not getting them now.
I know, so I was wondering if the fall, yeah, my kids have never been so healthy. It's crazy. And scary.
Arlene was asking a question which I missed earlier. If you have a suppressed immune system due to medicines, what can help increase your immune system? Well, really, let's see here. A lot of those things that I was talking about really are like the initial and the prevention are to help stimulate your immune system. So the vitamin D, vitamin C, fish oil is really good, and then the N-acetylcysteine or glutathione, and then the curcumin and the resveratrol. I mean, those are all very good at supporting your immune system. I hope that helps. There's not anything in particular, the zinc and kind of all of that stuff.
Did you have, I'll have to look at your show notes. Did you have that regime, those in the notes?
Yeah, so I had them under the initial prevention. So supplements for prevention, C, D, A, zinc, and then actually the treatment ones, the curcumin and the resveratrol, those were down in the treatment options. But those are good for improving your immune function. And
I did, since your last presentation, I did start to do the olive leaf extract. Is some of them, like, I know that quercetin, or I probably didn't say it, quercetin, some of those, do they have to build up in your system? Like, so you want to take them on an ongoing basis, or?
Well, probably the vitamins, those you would want to do on an ongoing basis. The olive leaf extract, I would kind of only take if you started to feel like you were coming down with something. Same with the herbal antimicrobials that are available. But the kind of the baseline ones, you know, and the other kind of the ones that I usually recommend for most people for baseline supplements, even without any testing, is vitamin D, magnesium. We're almost all deficient in magnesium, which is used in all of your energy production, all of your mitochondrial functions. Fish oil. Those are kind of the three big ones that I recommend for everyone, whether or not they've had testing or not. Olive leaf extract is a particular, there's a wide variety of supplements that have olive leaf extract in it, and it's antiviral.
Okay. Yeah, that was a new one to me too. My last question, just back when we had the first discussion, they found that are they finding you're more exposed when it's airborne, and like you said, someone literally like breathes it into
Yes.
you? Then so much as like having to Lysol everything that comes into your house and that kind of, I mean, that seems like it's going to have a detrimental effect to the amount of sanitizer and Lysol and chemicals.
Yeah, I'm having a really tough time at work in the emergency room because of all the chemicals that are now added to my daily exposure level. It's really frustrating. At home, for hand sanitizer, I typically use something that's a 60 or 70% alcohol and doesn't have a lot of other chemicals. Maybe it just has like a essential oil added to it. I try to stick with the non-toxic wipes. I don't use Lysol at home. But then my risk tolerance for infection is pretty high. You know, my family's healthy, I'm healthy. If you have baseline conditions, then you need to be a little more stringent about disinfecting things before they come in. I was really annoyed when the grocery store started doing single-use bags again. So I just take stuff, put it back in my cart, and then take it out to my car and then put it in my bag. There was something else that I wanted to say about that. Yeah, so, you know, they say that it can supposedly last on surfaces, hard surfaces like steel, for up to 3 days. So if you have someone that if comes into your home, you probably want to clean those areas. But if it's just your family and you hand sanitize when you get back from wherever you are, you probably don't need to disinfect the house all the time. UV light is really good at killing it. So typically when I go to the grocery store, I grab a cart that's sitting outside in the sun rather than having to use those gross wipes or bring your own wipes. And they say that it really decreases, the viral load decreases by 99% on fabric within 3 hours. So fabric is not a good surface for it. Olive oil and olive leaf extract are just two different things. So the olive leaf extract is the one that has the antiviral properties. Olive oil is a monounsaturated fat that is really good for you, but I don't think it has any specific antiviral properties. And then have you read about any correlation between food allergies and susceptibility to COVID? Nothing specific, but if you have a lot of food allergies and you're constantly exposing yourselves to those foods, it depends on whether or not it's an IgG or an IgE allergy. IgE allergies are a lot easier to identify because you tend to have pretty significant reactions. But if you have a lot of food sensitivities, IgG sensitivities, that can lead to gut inflammation and leaky gut and an impaired gut barrier, which can increase your risk of infection.
Yeah, I was asking because my son has multiple food allergies. So he is like anaphylactic to peanut and has milk and egg and cashew and pistachio allergies. And I haven't done any research myself, but I wondered if he falls into the like immunosuppressed category and we don't know it because of all his food allergies. So
it might actually be the other way around. He's got more of an overactive immune system because he's reacting to so many things. IgE is definitely an immune reaction. So, that could potentially make him higher risk.
Yeah, that's what I was wondering. Thank you.
You're welcome. And then Epsom salt baths are an excellent way to absorb magnesium, and they're an excellent way to relieve stress and get away from your children.
With your one glass of wine, right?
With my one glass of wine, yes. Do you think that somebody with autoimmune disease that has that disease under a good amount of control is still at increased risk? I think there's still I do a little bit, not as much as someone whose autoimmune disease is rampant, but your body is more prone to having an overactive immune system. So I do think that it does at least somewhat increase your risk. I don't know what that percentage would be. There's a question, but I don't know how to pronounce your first name.
Indy. I'm actually Rochelle's mom. Sorry.
Oh, hi.
Yeah. So anyway, and the question is, Rochelle wants me to come visit with the kids and stuff, and I live in Washington, and I live alone. But I'm kind of nervous. I haven't really gone out a whole lot. I finally went to the grocery store yesterday. It was my first time in 2 months. So I have a lot of fear. And I don't turn 60. I keep hearing over 65, you've got to watch it. So I don't know if it's the right thing to do to go out to her place, plus with the altitude and such. I mean, I'm healthy. I think I'm healthy.
I was going to ask if you don't have any underlying health conditions, and I would say if Rochelle and the family were pretty good at isolating themselves for a couple weeks before you came, then I think the risk is probably pretty low. My mom, who is 75 and healthy and lives alone, we're going to go visit her in a couple weeks because she's sick and tired of it. She's like, I'm fine, come visit. But I'm trying to but I haven't, I worry that I have a higher risk of being an asymptomatic carrier because of my exposure at work. But we're not seeing any sick patients at work right now. So, and my kids aren't really playing with anyone. And so, if Rochelle's family was extra careful for the 2 weeks before you came and had no symptoms, then I think it's probably fine. And it would probably be really good for your mental health.
And then I have to figure out how I'm going to get there. Am I going to drive?
The traveling, yeah. How far away are you?
In Washington.
Oh, yeah. So the traveling is an issue as well. So you would have to take a lot of precautions traveling. Just make sure you wear your mask all the time and carry hand sanitizer with you.
Thank you.
You're welcome.
Yes. Any other questions? Going once. Going to, that was good. And everyone's been, no, this has been awesome. And it's good to like, oh, Francis, okay, well, here we go. Oh.
Well, talking about Rochelle's mother is not whether to fly or drive, because we came home from California in March, and it was, I just felt every time we stopped at a bathroom, I was going to catch something, even though I took precautions of using hand sanitizers, Kleenex, everything to open the doors and touch anything. But I almost feel, what do you think about flying? Because are they keeping the planes pretty clean? And
from what I've heard, I think, well, one, I think it's very airline specific, airline dependent. I know someone who flew up to Seattle and flew back on a different airline, and one airline was really strict about making people wear their masks, and the other airline, and it depends on how many people are on your flight. If there's, and that's really hard to figure out before you go. If they allow a full airplane, then that's harder, even with a mask, to keep that
on you too, because we were supposed to leave for Arizona on Monday, and my husband called the airlines on Monday morning, and we had been told that the seats would be clear by us. Well, then if people start calling for reservations, they change that. So I think you don't know, maybe.
Yeah. So, at least if you're driving, you have a little bit more control of what you're exposed to.
And your own food too.
And you can bring your own food and drinks. Yeah.
That is a good question as we start to venture out. Speaking of, I just got a call from the pediatrician that Kinley's due for her shot. So you think it's safe now to bring the kids back for like routine check-ins and stuff?
Yeah. And that's one of those interesting things in the New Yorker article that they talked about, is that hospitals have been really good at decreasing transmission within the hospital. So our local hospital, there's screeners before you go in the building. They check your temperature. They ask if you've had any symptoms. They make sure you have a mask. They're cleaning all the rooms in between people. And so the risk of transmission in hospitals now is very small. If you're having any type of elective procedure, they swab you. If you come back positive, you don't get your procedure. You don't get let in the building until your swab comes back. So I do think that the hospitals are probably the cleanest places that you can go. We've in our hospital, we've seen quite at the beginning, we saw a bunch of patients, and none of our nurses have tested positive, or the physicians have tested positive from being exposed to known positive patients.
Cool. Well, yeah, thank you. Thank you for your extended time. Coming up on 53 minutes. So yeah, I have this recorded. I'll share it with you as well. Jennie said we can share. I feel like this is something that, we'll share with as many people as we can, because there's such good information. So once we get that together and you guys see the recording, feel free to send it to anyone, as long as you're okay with that. But I just feel like the more people know, the more power they feel they have, and the less fear. And that's kind of what we all need to be empowered with more right now, what we can do.
I agree.
So, yes.
Yeah, well, thanks for having me.
Well, thank you. All right, okay. I'll unmute everyone so you can say bye.
Bye.
Thank you.
Thank you.
Bye, everyone. Bye. Thanks, Jennie.
Bye, Jennie.
Bye.